aiming for 100,000 tests daily by Thursday, but on Saturday, 25,000 tests were done. Are you still on track? How can you convince us that you are?
Well, I'm going to briefly talk about capacity, and I know Piers will have a view on that, but let me do that and then answer your question specifically, if I may, Susanna. So capacity is now dramatically increased. And actually, over the weekend, it was 29,000 tests were done. We are seeing a significant increase in the number of tests, and we saw a significant increase in the eligibility criteria at the very back end of last week for those tests. That's why it was important we built up the capacity first, because we are seeing now, and it's just coming through the system now, significant increases in the number of people applying.
If you've got such enormous capacity, and I know that the government's inclined now to focus on capacity rather than numbers of testing, and yes, you're absolutely right, 29,000 tests on Saturday. But if you're focused on capacity, how come on Friday your tests ran out?
Well, that's one of the reasons we were significantly increasing capacity. That's why I know it was frustrating sometimes in interviews on GMB and elsewhere. We talked a lot about capacity. That's why we built it up, and that's why we are significantly increasing it day by day.
If you've got the capacity, sorry to interrupt, Mr. Argar, but if you've got the capacity, how come those people who logged onto the website on Friday found that the capacity had run out within literally a couple of minutes?
So you've got a number of different types of ways of getting the test. The first one, which is important, is Pillar 1, which is essentially the tests in the workplace for frontline NHS staff and others. They continue to be able to get that priority access to those through that pillar in their workplaces. You've then got the tests for the wider range of essential workers that we expanded the testing to last week. We have the drive-through centres, over 30 of those, but what people are showing they really want, or a lot of people want, are either mobile testing centres, so we've got over 90 of those now in people's towns to make it easier, and the home testing, which has proved extremely popular, and we are ramping that up.
How many people did you test in the last day of record?
Well, I think that's the figure that that Susanna was giving there, which is the 25,000.
Yeah.
What Matt Hancock was very clear about was his target was 100,000 tests.
Yeah.
Right, but do you understand, though? Right, I mean, obviously, look, I understand all this talk about capacity. I mean, look, Matt Hancock's the one who set this target. He's now being judged against a target that he just created for himself. I don't understand why he felt the need to do that. The Prime Minister had already said we're aiming for 250,000, but didn't put a timeline on it. That seemed to me far more sensible. So we now have this sort of absurd artificial race in 4 days to see if Matt Hancock reaches his target. But the reality right now is we tested 25,000 people on Saturday, and actually that's 75,000 short of where he needs to get to in terms of people tested. My bigger concern is you can talk about capacity and testing and everything else, but my bigger concern is the massive, I don't know what you would call it, you can use a phrase for me if you like, situation that has unfurled in our care homes and in the community. Because every day we get told of the reported increase in the death toll in hospitals, but we don't get anything like a daily report on how many people are dying in care homes. And the most disturbing thing that I heard in the last few days was that we only began testing elderly people who'd been in hospital with COVID-19 as to whether they were negative before they went back to their care homes 11 days ago. In other words, we were sending back, I don't know how many, I might ask you if you know, a lot of people back into care homes who were COVID patients who had not been cleared as negative before they went home. And now we have an explosion of cases and deaths in care homes.
Well, Piers, firstly, you wouldn't expect me to, and I'm not going to put words into your mouth or give you a phrase. I'm on your show and Susanna's show. I'm here to answer your questions, not in a sense pose them. You talk quite rightly about care homes, and yeah, absolutely right to focus on care homes and the data. As you all know, and as you quite rightly challenge us on whenever we come on your programme, the last verified data, the ONS data, dates back to the 10th of April for broader community deaths, including care homes, reflecting death certificates and the lag there is on that data coming through.
And how many were there at that point? How many deaths in care homes were there?
4,927 at the 10th of April, but that's 4,927 deaths, every one of them a tragedy for friends and family, of people who were care home residents. But there is a chance there of some double counting, because that's care home residents, and it doesn't differentiate between whether they died in a care home or whilst having been transferred.
But the Financial Times, as you're aware, has done extensive reporting on this. And the Financial Times is saying that their estimation is that at least 43,000 people have now died from COVID-19 in this country, which is 22,000 more than the official figure put out there. At the moment, we are the 5th worst country in the world for death toll, and rapidly approaching Italy and Spain and France. But if you add, even if we added half of the estimation of the Financial Times of the people who've actually died in care homes and community, that would take us to the 2nd worst death toll in the world. And I keep hearing, and I understand why the government does this, the positives. You know, the NHS didn't get run over so far. Good. You know, you're ramping up testing. Good. All these things sound good. What I don't get from the government is a simple explanation as to why it is that we are now heading to be the 2nd worst death toll in the world. What has gone so badly wrong, Minister, that is the case?
Well, 2 things, Piers. Let me first address your question about that data and the Financial Times piece, if I may. That is based on an extrapolation they did from the beginning of April of excess deaths, i.e. the number of deaths recorded at that point over and above what we would normally expect as on the basis of previous years. You're right about the importance of getting those numbers so we can see the true scale of the toll this dreadful disease has taken. And that's why you'll see later this week publication of the next set of data, a more regular publication of that data. We see it in the FT, and we've seen it with a lot of press outlets coming up with models for this. That's entirely legitimate for them to do that. But as a government, we've got to make sure the data is verified. We're doing that. You were right to highlight the importance of this, so we know not only the terrible toll this disease is taking in our communities and in our hospitals.
You have not been testing everybody with symptoms in care homes. We have been completely behind the curve when it comes to testing in care homes. Those who run care homes say they have had extremely difficult problems getting hold of tests for their staff, for their residents. So how can you talk about accurate data and getting a full picture if you don't know what the situation is in care homes?
Well, the accurate data I was talking about there, Susanna, was the ONS statistics, the statistics that Piers, quite rightly, has asked us about on previous occasions, the ones taken from the 10th of April, and the need to keep those up to date on death rates, not just in hospitals, but in the community. And that's the sort of data that can help those scientists assess and refine their modelling to make sure we get the best advice. You're right about testing in care homes, and you will have seen from the announcement at the back end of last week by Matt Hancock, the expansion in testing and the fact that Public Health England have said that in a care home where there is a case, they will get rapid deployment of tests for all of their residents and staff, and they will get those results back in 48 hours.
Why weren't you testing everybody before they went back to a care home to see in hospital if they still had the disease? Why were you sending time bombs, human time bombs, back into care homes that have now caused a complete disaster?
Well, Piers, we made clear we were prioritising testing for those in hospital and frontline care workers as we ramped up the testing effort. We've significantly increased the amount of testing.
But you're not answering my question, Minister. With respect, the specific question was, why was it only 11 days ago that you as a government decided it was a good idea to test people who'd been in hospital with coronavirus before sending them back to care homes? I don't understand why you wouldn't have done that as a matter of course.
Piers, you asked me the question, and I have never shied away from coming on your show to answer the question, so let me try and answer the question now. We focused the capacity we had in testing on where the scientific and clinical advice said that would be most effective in controlling the virus, but also, importantly, keeping the NHS functioning with the staff it needed to be able to treat people. We are now significantly expanding that testing, both in terms of what we are able to do, but also on the advice of PHE and others on how we should expand that.